If you've been dealing with rotator cuff tendonitis, you might think the problem is just inflammation in your shoulder. But what if I told you the real issue could be instability caused by something called the IGHL? Understanding this ligament could be the key to finally getting pain relief and avoiding unnecessary treatments. Hello, I'm Dr. Siddharth Amber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and optimize your health with cutting-edge treatments. Today, we're talking about the IGHL, or the inferior glenohumeral ligament, and why it matters if you have rotator cuff tendonitis. This is something most people and even many doctors overlook. But if you want to truly fix your shoulder pain, this is a critical piece of the puzzle. Rotator cuff tendonitis is one of the most common causes of shoulder pain. You might have been told it's due to overuse, inflammation, or muscle weakness. While those can play a role, the real root cause often involves shoulder instability, and that's where the IGHL comes in. The IGHL helps keep your shoulder joint stable. When it becomes loose or weak, your shoulder moves too much, leading to excessive stress on your rotator cuff. That constant irritation can cause tendonitis, pain, and even long-term damage. So if you're struggling with persistent shoulder pain, treating the inflammation alone isn't enough. You need to address the underlying instability. The inferior glenohumeral ligament, or IGHL, is one of the main stabilizing structures of the shoulder. It connects the humerus, the upper arm bone, to the glenoid, the shoulder socket, and helps keep the joint in place during movement. In particular, it helps prevent the shoulder from rising upwards. So think of it like a strong seatbelt for your shoulder. It keeps things secure while still allowing motion. While the IGHL is healthy, it prevents excessive movement that could damage the rotator cuff. But when it becomes stretched, injured, or weak, the shoulder loses stability. This leads to excessive movement of the humeral head, which strains the rotator cuff. Chronic irritation leads to tendinitis, increased risk of further injuries like labral tears, and eventually arthritis over time as well. Most people with rotator cuff tendonitis are told that inflammation is a main issue, but inflammation is just a symptom. The real problem is micro instability of the shoulder. When the IGHL is too loose or weak, your shoulder isn't as stable as it should be. This means that your rotator cuff has to work harder to compensate for the lack of stability. Over time, the tendons become irritated and inflamed, leading to pain and dysfunction. Typical treatments like rest, ice, and anti-inflammatories don't fix the root cause, so the pain keeps coming back. So how do you know if your IGHL is weak? If you have rotator cuff tendonitis that isn't improving, IGHL dysfunction might be to blame. Here are some signs. Your shoulder feels unstable or loose. You have pain with overhead movements. In particular, pain underneath the armpit, which is typically where the IGHL actually sits. Your symptoms get worse with activity, but don't fully go away. Physical therapy helps temporarily, but doesn't fix the problem. A proper physical exam by a specialist can help confirm if the IGHL is involved. Imaging like an MRI might show rotator cuff irritation. It might even show that there's drifting up of the humeral head on the glenoid, but it doesn't reveal the actual underlying instability or damage to the IGHL. That actually requires clinical expertise. So why do typical treatments often fail? Most people with rotator cuff tendonitis are given the same standard treatments. They're told to rest in ice, which gives temporary relief but doesn't fix the instability. They may get a cortisone injection, which can reduce pain, but they actually weaken tendons over time. And frequently, they'll end up getting referred to surgery. This may address severe tears, but it doesn't restore the natural stability. These approaches focus only on symptoms, not the root cause, which is instability. If the IGHL remains weak, the tendonitis will keep coming back. So how do you fix the IGHL and truly heal your shoulder? To truly recover, you need to restore stability to your shoulder. Here's how. First thing is strengthening the shoulder the right way. Focusing on stability exercises rather than just rotator cuff strengthening is key. Isometric holds, which help to activate stabilizing muscles without excessive strain. Closed chain exercises, like wall slides and plank variations, improve stability. Scapular control drills, which will help to enhance shoulder biomechanics and reduce strain on the rotator cuff. If your IGHL is significantly weakened, regenerative medicine treatments can help stimulate natural healing. These include prolotherapy, which are injections that stimulate collagen production and tighten ligaments, platelet-rich plasma, which uses your own body's healing platelet factors to repair ligament damage, and bone marrow-derived stem cells, which promote longer-term healing and regeneration. These treatments strengthen the IGHL, restore shoulder stability, and relieve rotator cuff stress by utilizing your body's natural healing process to address the problem at its root. To truly heal, it's important to also avoid treatments that can worsen instability, such as cortisone injections. They weaken soft tissues and don't fix instability. Surgeries that are just cutting out tissue. Removing parts of the rotator cuff or labrum can increase instability long term. The goal is to rebuild and strengthen your shoulder, not just manage pain temporarily. If you have rotator cuff tendonitis that isn't improving, the IGHL might be the missing piece of the puzzle. Shoulder pain is often a problem of instability, not just inflammation. And treating it the right way can make all the difference. Instead of just masking symptoms, focus on restoring stability with the right exercises and regenerative treatments. This approach can help you avoid unnecessary surgery and get back to pain-free movement. If you found this helpful, make sure to like, subscribe, and share this video with anyone dealing with shoulder pain. If you want expert guidance, visit chicagoarthritis.com to schedule a consultation. Thank you for watching. Take care and live well.